what does COVID-19 mean to you?
It just means a terrible virus.
Are you listening?
Hey guys, welcome back to my channel. I'm your girl Shantae, and today in my world, I'll be doing an interview with my best friend Lauren. And I decided to do an interview with her because we all basically know how COVID-19 has affected us, like either personally or just seeing stuff on the news, hearing different stories, people passing away, things like that, which is terrible. And I just felt like it was a good time to do an interview with her on the simple fact that she kind of worked hand in hand. Well, not kind of, but she actually does work hand in hand with COVID-19 and just dealing with patients and their families and doctors and nurses because she actually works inside of a hospital. So I'm going to ask her a couple of questions and just try to get a better point of view on her point of view of what happens on a day-to-day basis with her inside of the hospital. So Lauren, go ahead and introduce yourself.
Hey YouTube, I'm Lauren. As Shantae stated, I work in the hospital. I work in the emergency department. I have a dual role as a health unit coordinator, which is the person that answers the phones and makes the calls for the doctors. But I'm also a ER tech, which some of you might know as a PCA, and that's where I'm hands-on with the patients.
Okay, so you really do see a day-to-day of everything that goes on.
Mm-hmm.
So that makes sense. Basically, like I said, I know that we all are dealing with it, but I feel like nurses, PCAs, HUCs, doctors, everybody that's really in that field of being in either a nursing home or being in a hospital, a clinic, is just really getting a different feel for it compared to me that's doing different things outside of being inside a hospital for, what, you do 12-hour shifts?
12 hours.
12 hours. So, like I said, I got a couple of questions for her. And y'all see my little cute cord again. So, the first question I had was, how many years have you been working in the ER?
I have worked in the ER for 8 years.
It's been 8 years.
It's been 8 years. So, when I first started, I was the tech or PCA. And then after 5 years, I was the health unit coordinator for 2. So, I just recently went back to being a straight ER tech.
So, which one do you like better?
Tech. As the health unit coordinator, you gotta sit there, answer the phone, be almost cussing people out. It just gets too much. All the phone calls, you got nurses in your ears, too much. But as a tech, I'd rather do patient care. Like, I like helping the people instead of helping the doctors.
So this is not really a part of my question, but to go off of that, what exactly do you do as a PCA?
So as a PCA, if you are coming to the ER, I get your vitals. I do EKGs. I draw blood. If people need changing, I change them, walk them to the bathroom.
Right.
We do visual acuities, which is an eye test. We are transportation because in our ER we don't have transportation. So I have to take people upstairs to their rooms when they're admitted, take people to their cars. We do too much.
So you do a lot. Mm-hmm. So a PCA, I mean, honestly, is just as important. Not saying you ain't important anyway, but you're just as important as being really right under a nurse.
Mm-hmm.
So I feel like it goes for real, like doctors, nurses, and then PCAs.
Yes.
That's a lot. That is a lot to intake in the hospital, and just being a tech, but then dealing with COVID has to be extremely 10 times harder, I should say. So, number 2 out of my questions was, what does COVID-19 mean to you?
It just means a terrible virus. Honestly, like, I think a part of me is kind of immune to it because I work with it and I see it every single day. So maybe I shouldn't say immune, but I'm just so used to it.
Right.
So, like, COVID-19 right now to me is like the flu. It's a virus and it's here, and we just have to try to stop it. We got to try to stop the spread. It's definitely real. Like, I really hate when people say,
goodness,
COVID-19 is not real. It's man-made. Granted, it probably is a man-made virus. A lot of viruses are man-made. They're made in a lab and they get out.
Exactly.
But it's real. Like, people are dying from COVID-19. My father had COVID-19. My boyfriend had COVID-19. Like, it's not a joke. It's not a game. It's not something that people are making up saying, I'm just sick. No. It's real. Like, the shit is real, y'all.
And I believe that it's real, too. I just think it's It's scary.
Mm-hmm.
I think it's sad. I think at first we all were like,
yeah,
virus too. And then when it started hitting home, or you start hearing stories, or you get on the news, I promise every time I get on the news, the first thing they're alerting you about is COVID-19. The numbers increasing, the numbers trying to decrease, who have died. Like, it's terrible. Like, it's terrible. And even terrible having to everyday wear this mask. Like, oh my God. And I try, you try not to complain, but when your world gets shifted in the whole 360, it changes. You like,
everything.
Oh my God. So when I don't have on my mask, I'm like, oh, I'm like, girl. Like, or you get all the way to the car. No, you go to the store. You get all the way to the front door.
You gotta go back to your car.
I gotta go back to my car to get my mask.
You're so mad.
It's like really a part of our everyday life. And don't get me wrong, I always wash my hands.
Yeah.
I always use hand sanitizer. I always spray Lysol. But now it's like, girl, you
don't forget.
Don't forget to do that because you just never know. Like,
yeah, that's what I was telling somebody at work too. Like, you never think about washing your hands after you pump the gas tank. After you pump your gas, I put on hand sanitizer right after I pump gas.
Me too. When I pump gas, as soon as I touch money, because money is one of the dirtiest things you can touch anyway. But, a lot of people, matter of fact, honey, when I be going to the grocery store, a lot of people lick their hand to do the plastic bag, which I always thought was gross anyway. Sorry if you do that, but I just think it's gross. But it's like now, I overheard this guy like, you know what I hate about COVID? I can no longer lick my finger to open the plastic bag. I'm like, honey, you shouldn't do that anyway.
Right.
But I understand what he's saying. We're taking out our norm. What we were so used to doing, we can no longer do it. And it's like, oh my God. Like, when I say it's...
The little stuff that we should have been thinking about, we weren't. But now it's like...
We want it back.
It's there.
As simple as not wearing a mask. You wore a mask, like sometimes if you went to the hospital and you seen like your grandma, or maybe if they were sick, you went to a nursing home, you maybe put on a mask. But to have to wear a mask every time you step out your front door... Yeah. It's crazy.
Have to wear a mask for 12 hours.
12 hours, then people that got 8-hour shifts. I know at my old job, we had to wear gloves and wear masks. When I say terrible...
Yeah. It's bad.
Terrible. Number 3, how has it been working in the ER?
So in the beginning, it was like really slow. Like, people really were listening. They were staying at home. They weren't going out. So it was slow. It was actually a nice little break from like the hustle and bustle of the ER.
Because the ER don't stop 24 hours.
Now that, the world is kind of basically opened back up, we back to... It ain't even COVID. We back to the little stupid STD checks. We back. People having car accidents. People doing this, doing that. And it's like, the world is open, so people have to go out. They have to do things. Right. So it's back. We busy. We booming. Hospital has been full since July.
Oh.
I think hospital has been full since July. We have a full ER every day. People waiting in the waiting room for 5 hours. We had somebody with a motor vehicle accident in a waiting room for 5 hours with back pain. Because we kept getting squads. We kept getting squads or the ambulances. We kept getting people coming in that were sicker than a back pain. So you got to take them back first. So it's very busy. It can be very depressing. We see a lot of people die. Like, literally, like people are dying. And where my hospital is, it's surrounded by nursing homes. So
right, you get more so older.
We getting the older people and the nursing homes are filled with COVID. So if you mad that you can't go see your grandma, I'm telling you, it's for them.
Just think it's better off that you can't go see her.
Because they're not leaving the nursing home. So COVID is getting there because people are coming in.
Exactly.
So we have a lot of deaths. It's probably like 1 or 2 a day. So it's just sad. It's depressing. It makes you not want to go to work, but somebody got to help the people, so we got to go.
Oh, I agree. Like, I used to actually work in the ER with Lauren at the same hospital every day. I got her job. So, no, but we used to work there, like, and I did registration. So, basically, I would be taking the patients back to Lauren in the sense that she'll start to do the vitals, draw blood, and things like that. But, me working there versus her working there during this pandemic, of course, I saw people die, which was, horrific. Of course, you talk to families, you deal with patients. You have those good patients in them times where you happy that they were able to walk out the door. And like she was saying, some people don't get to walk out the door. But so far as what you were saying, so far as the guy with the 5-hour wait, I remember that, like if a registration, they come up to the registration table and two people come up at the same time. If this person has a back pain, but this person has a heart attack, I'm going to take the heart attack back because, you know, that's something that could be really life or death.
Yeah.
Your back pain could be some medicine or maybe an x-ray that you'll have done, but that's really sad because, mind you, I seen plenty of people. I worked at the hospital for 3 years. I seen plenty of people pass away, which is sad to say, but on a daily basis, one or two a day, that's terrible.
Yeah,
like,
it's really hard.
I really feel like we in a movie. Like, when I say I wish we can snap our fingers and this all vanish or go back to 2019, you know, everybody, 2019 was out to, it was this. And it's like, if I could go back, I would probably go back because we wouldn't be dealing with this.
Yeah.
We wouldn't be dealing with none of this. And it's like I don't know if it's other people, I don't know if you the same way, but when I can't control something or something is out of my control or there's nothing I can personally do, I feel some type of way. So this really is terrible because there's nothing we can do. Yeah. Nothing.
Yeah.
As a person or as people, nothing.
And they're dying alone because we not allow visitors in the hospital. So, like, we had this one lady, she was like in her 50s. Her kids was our age. So we let them back.
Period. You just, I mean, you gotta break the rules.
Yes. She had 3 kids. So when you're dying, you can have 2. They got to look at you through the door. She had 3 kids. We let them 3 kids back. That was their mama. The one girl had just talked to her mama. She was like, I'm just about to go to the hospital. I'm short of breath. Died on the way to the hospital.
Did she have COVID? Oh my.
Yeah. So it's like stuff, but that's what makes it depressing. Like you have these family members who want to see their parents or their grandparents. Like, these people are dying by themselves. I feel like nobody should die alone. Like, that is the worst thing. The worst way somebody could die. It's just like you there by yourself. Like, it sucks.
And like, imagine just what they're going through, what they're thinking, like what's running through their head because you don't have nobody to sit on the side of you to hold your hand to, like,
just to help you ease it to transition peacefully.
Right. I couldn't imagine. And even funerals nowadays is a 360. You can't even. Some people are doing it virtual or you doing a Zoom funeral. Just like. So much stuff has changed. Yeah. It doesn't make any sense. And we almost are really going into a year of COVID. Like, it probably really started, I want to say, when I really noticed was towards the end of February. Yeah. We're already at the end of December. So come February, it will be an entire year of COVID-19.
And see, for us, it really started like a year ago.
Right.
Because people had COVID and they didn't know.
They didn't know
thought they had the flu.
A lot of people said they had the flu
twice. That was the flu and COVID. You can have the flu and you can get COVID. And for people that say they can't get COVID twice, you can get COVID twice.
And I have heard that. A lot of people, I have heard stories like, I done had it once. I done got this. I done felt better. So I probably won't get it again. I don't think I'm going to get it again. I have heard like people saying that.
You can get the flu every year. You can get the flu twice a year. You can get COVID twice. Yeah.
Oh, so sad.
Yeah.
Number 4. Have you personally been afraid of getting COVID-19? Because in the beginning, y'all, I'm as her best friend, in the beginning, I already know I'm going to get it. I'm going to get it. We like, why would you keep saying you going to get it?
And honestly, I still do think I'm going to get it. So, I work with people 12 hours. So, you have people, first of all, you have people who have COVID. We had a younger girl. I'll keep giving y'all examples. We had a younger girl. She had COVID. She came in for a motor vehicle accident. Strike 1. When you have COVID, you're supposed to quarantine for 14 days. You're supposed to stay in the house. So she comes in the ER. She has to get admitted because her COVID and the MVA is messing up everything.
Right.
So she says, can my dad bring me something to eat? We said, well, where did you get COVID from? My dad. Strike 2. So then she says, well, my dad was just at Dollar General buying my sister some toilet paper. So you want your daddy to come to the hospital. You was out and about. He went to Dollar General. We had to tell her, like, do you know you could go to jail? Like, you could go to jail for not quarantining.
It's that deep.
Yes.
It's that serious.
So it's not that I want it, but when you work in the ER, like now, it's starting to hit the hospital staff. There are so many hospital staff
I've been hearing stories
that
about
are getting COVID. So it's scary, but not so scary. Like, my boyfriend had it, and he was basically living with me, and I had to take care of him. I have an N95 at home, and I have an N95 at work. So, yes and no. Like,
N95.
The mask.
Just in case you didn't know.
it's the hospital mask. Like you get sized for it. So the masks that people wear outside of a hospital, those aren't the ones that are like fit tested.
Right.
That's just a standard
mask.
It's called KN95 for like the standard ones. But we have the N95s where we have to get fit tested and it fits the seal of our face. So nothing gets in, nothing comes out. But I mean, so yes and no. But I do feel like eventually I probably will get it. I hope that it doesn't hit me as hard as other people, but I just feel like it's a matter of time because it's so many people coming in. And like now, you don't know if you had a flu or if you got COVID because the symptoms look the same. So like we deal with it every day. And like in the hospital, if you come in, say you come in with chest pain, but then you get in the room and you say, well, I got chest pain, I got shortness of breath, I got a cough, I got this.
Because the thing is, when you used to come in the ER, not to cut you off, but like I said, I was registration. So mind you, when they tell me when that line say what you coming in for, 9 times out of 10, they're going to give me the main thing that's going on. Yes. So if they have chest pain and they back hurt, they're going to say chest pain, of course, because they want to get back. But then when you get back there, like she said, they name 10 other things.
Else. Right. So when they're naming everything else, we already in a room. Yes, we still have on a standard hospital mask, but that's nothing. That's like the mask that they give you at Kroger. Those masks, I mean, it protects you a little bit, but if you face to face with somebody with COVID, it's not protecting you with nothing. So we don't know if that person has COVID. So then we got to go out the room, but we already been exposed.
Exactly, because you're not.
So it's hard. I don't know. I guess I'm optimistic because I'm younger and I'm for the most part healthy. I only have high blood pressure that I'll be okay, but I'm worried about taking it home to my mom or my grandma or something like that. So that's the scary part, giving it to somebody else that won't be able to handle it. Like my grandmother is 85. She's not going to be able to handle COVID. My mom has diabetes, high blood pressure. She's not going to be able to handle COVID. So that's what's scary, is giving it to my family member and making them sick and possibly dying. That's the scary part.
I feel like you said, I mean, to me, it's scary altogether. But, you know, I also think as a person, you have to do what you can do for yourself. And you can't always worry about other people. And what I mean by that is, like, me every day, I'm wearing a mask. I'm washing my hands. I'm using hand sanitizer. I'm spraying Lysol. I'm wiping down stuff. I can only do that for me because I know that that's the role I'm going to play, because I'm trying to be protected as well as helping other people by not having them exposed to anything. But, you know, I see our people sometimes with still no mask on, because a lot of people, like we were saying earlier, just don't believe that it's real. Like,
they just don't care.
They don't care. They don't believe it's real. They feel like it can't happen to me, you know, and nobody really takes consideration to something until it does happen to them. Yeah. Or until it does happen to somebody that's really close to them. So, you know, I always just tell myself, like, I have to play my part because I want to stay safe. And if it causes somebody else to be protected, then I feel like I'm doing something. I'm doing something right.
Definitely.
Like, period. It's nothing to play with.
Nothing.
Like, period.
It's not a game.
At all. And if it is a game, honey, I want to quit. Let me out.
Don't pass go. I don't want to collect my $200.
I don't want no money. I'm out. Okay. Number 5. What does a typical day, night in the ER look like with COVID-19 around?
So when you get to work, my shift is 11A to 11P. So when I get to work, I go in my regular clothes, like something like this. I have my cap. We have caps to protect our hair because when it first started, they were saying that it can live on our hair or something like that. So we don't really know if that's still true or not, but I just wear my cap every day. And my hair not done, so it works out. So we have our cap and we go in our regular clothes. So when we go, we have something called surgical scrubs. And it's basically just plain scrubs that don't have like our link or logo on or anything. So we change. I put my clothes in a patient belonging bag and I stuff them in my locker. Our locker is locked out from everything. It's just for employees. And I do shoe covers. I change my shoes and I wear shoe covers on my work shoes. Sometimes I do go to work and I don't wear like my work shoes, so I'll wear the shoe covers because I got to wear my shoes.
Right.
So once we change, we can go to the front, we get our phone, and that's the day starts. So the 11-11 shift is the most busiest shift because if you remember, that's when the ER, at 11 o'clock in the morning, that's when it starts jumping. That's when everybody feeling sick, don't want to go to work the next day, everything. So we get patients, we get squads. A lot of the things lately have been squads. It hasn't been a lot of people walking in, but squad central, that's what we call it.
Repeat offenders. When you work in the emergency room, it's so many repeat offenders that comes in, you wouldn't even think.
Yes. So that's basically it, you know, for 12 hours. Oh, and I also put on 2 masks. I wear the N95 that I was telling you about, and then I wear the hospital, like just a surgical mask on top of that. Because we have to put our stuff in a brown paper bag, which is not sanitary at all. But we put in like a brown paper bag, look like a sandwich bag. We put our mask and our face shield. So I wear the surgical mask on top of my N95 so that the germs aren't going into my mask where my face shield has to go. I can wipe off the face shield because it's like that hard plastic. Yeah, so you can wipe that off with like a bleach wipe. So that's fine because it's going in there clean. But my N95 is not going to be clean if I don't wear something over it. And I keep that in my locker. Everybody else keeps it on like this cart that's in the ER. I feel like that's not sanitary.
It's like airborne. It's like mad stuff going around.
So I keep mine in my locker. So I'll do that. I'll have 2 masks, and if I'm dealing with a COVID patient, I wear my face shield. I wear my glasses because they want us to wear goggles, but we have to share the goggles, not sanitary either. So I wear my glasses that can act as my goggles, and then I put my face shield over it so nothing can get like under or over it.
Right.
But yeah, that's it. Like, and then just getting patients out the lobby, dealing with codes, which is like when people come in dying, where we have to do CPR. Everybody gets tested for COVID for the most part. So running swabs up and down the steps to the
I was
lab.
gonna say that too. Like, do y'all personally get tested?
No.
Oh, okay.
So I don't know how other hospitals are, but the hospital that I work at, this is about to sound really bad. We can come to work if we are COVID positive with no symptoms.
Didn't know that.
We can't come to work if we have any symptoms. So fever, cough, short of breath. If we have not been tested, we have to get tested. And once we're tested and we have a negative result, we can come back to work. But if you are positive and you don't have symptoms, they are telling us that we can go to work.
I didn't know that. Because I know my cousin, she works at a nursing home. And
they get tested every week.
Yeah, I was about to say, she said she gets tested every week. So she got to go through the trauma of getting that Q-tip stuck on her nose every week. Yes. I mean, she kind of said, like, I'm a little bit used to it, but still, it's the fact, like I said, working around older people and families trying to come in certain times and things like that. You can't really have nobody in there, just staff. She definitely gets tested every week.
Yeah. So that's something that's only for nursing homes, though. It's not.
That's so weird.
That's not for us. And I think a part of it is, too, because if they was to test everybody that in the hospital once a week, they wouldn't have no staff.
Yeah, I agree. A lot of people would.
A lot of people would probably test positive.
I agree.
Yeah, so it's in a way they trying to keep staff, and it just look real careless. Like they don't really care, but I mean that's what we have to deal with.
It's kind of like it's a good and a bad. Yeah. It's a good because you trying to help. You got to help other people. But then it's like a bad because it's like you almost don't get to help yourself.
Yeah. Yes. Yes. So that goes back to why I'm kind of not scared, or why I think I'm gonna get it, because we don't know if people got it or not.
Woo, y'all! This COVID-19 ain't no joke. I just hope people, like, if you're not taking it serious, I really hope you start, cause
I don't want to be pressing on your chest at 10:30 when I'm about to get off at 11.
Petty, but no, seriously, because this sad. It don't care how old you are either.
It don't.
I mean, because little kids could get it up to, like we said, your grandparents. Yeah. So it really don't care who it comes in contact with.
Nope.
You just need to try to prepare yourself so that way you don't have to go or don't come to you. Do the best that you can do before it goes there. Yeah, to prevent it.
Yeah.
So my last question was, what advice would you give people about COVID-19?
Number one, wear your mask. Just, first of all, can't none of y'all complain about wearing a mask to the grocery store for 20 minutes, because I just told y'all I wear 2 masks for 12 hours. I don't take those 2 masks off at all. Only to drink and only to eat. Y'all can't complain. Y'all got 20 minutes to, or it might even be an hour. All y'all doing is shopping, spending money.
Still.
Do it online if you don't want to wear a mask. Wear your mask. Wash your hands. Wear your hand sanitizer. Keep it in your purse. I got one in my purse, my car. I got one on my badge at work. I have one at home. I have hand sanitizer everywhere. Everywhere. So yeah, make sure you're washing your hands, wearing a mask. And honestly, if you have COVID and if you are not, this is about to sound bad, but if you are not dying of shortness of breath, if you cannot breathe, go to the hospital. But if you are sitting at home and you barely got symptoms, stay at home. Do not come to the hospital, because all you're doing is putting more people at risk.
Right.
Quarantine. They tell you to stay at home. I know you got a friend, a boo, whatever you want to call it, somebody that can bring you some food, get you some groceries, something like that. All they got to do is leave it at the door. You open the door, you get the stuff. Don't go out your house, because it's not worth it. Because if you're not having symptoms, you going to the grocery store past my 85-year-old grandma, and you're going to get her sick. And then I'm going to be mad, because all she was trying to do was get some zucchini, because she eat real healthy. So just do that. Just quarantine. And honestly, take your vitamins, because vitamins are helping build immunity. You need to have a strong immune system. Mm-hmm. The people that are really sick are the ones that have a weak immune system, that are sick already, or have comorbidities like diabetes, blood pressure, things like that. So the big thing I say is wear your mask. If you're positive, stay at home unless you physically cannot catch your breath. If you feel like your heart is about to jump out of your chest, if you really feel like you are about to die, go to the hospital. But if you don't feel like that's going to happen, stay at home. It's not worth it. It's not worth you, and it's not worth us, and it's not worth all the people that you have to walk past to get to your room, to the ER, to do. It's too much.
And if y'all don't know, the ER is one of the most nastiest places to be. Really, the hospital is, but the emergency room is terrible. And it's not to say we don't clean or wipe down or sanitize or anything like that. It's just, it's a hospital, so it's already not as sanitary as it needs to be. It's germs. That's why people always come to emergency room. It's so cold in here, because the air kills the germs.
Yeah.
It kills the bacteria that's floating around and everything. So you don't want to be there anyway if you don't have to be there, because they don't do nothing but give you more chances and more risk to become sick.
Get sick.
Right.
And if you ain't coming in for COVID, you get sick, you're going to have something else. Then you're going to really be mad. Like, I should never went to the hospital. You're right. You shouldn't have.
So at the end of the day, make it make sense. That's just it. That's really what it boils down to. But like I said, I feel like this interview was very important because, like I said, me on a day-to-day basis, I'm not in and out of the hospital. I'm not working there. I no longer work with Lauren. So, I just was like, let me really get an insight on somebody that's in the hospital and see what they really go through, because you only hear stories. You don't really know exactly. She tells us stories all the time. But, to really sit down and really get her perspective on it, I just felt like that was very important.
Yeah.
So, guys, I want to say thank you for tuning in. Thank you for coming into my world today. Please make sure that you like this video, comment down below, share, tell a friend, and tell a friend. And make sure that you subscribe, guys. I would love to see you in my next video. Bye. Peace.
Only place I wanna be is in Shantae's world. Only place I wanna be is in Shantae's world. Let's talk about it, Shantae. Let's talk about it, Shantae. Let's talk about it, Shantae. Don't talk about it, Shantae. Let's talk about it, Shantae. Let's talk about it, Shantae. Let's talk about it, Shantae. Don't talk about it, Shantae.